So have you been diagnosed with osteoporosis? Are you feeling a little overwhelmed by all the information about medication that your doctor is talking to you about? Watch this video to learn a natural solution to improve your osteoporosis with exercise. Now, could you do me a favor and go subscribe to my channel and click that bell so you can be notified of all my content? It'd be awesome if you did that. So what exercises should I do? And what exercises should I avoid with osteoporosis? By the end of this video, you will know the essential movement to avoid, as well as the #1 bone building exercise out there. I've helped hundreds of patients with this condition over the last 2 decades as a physical therapist and look forward to helping you as well. So what is osteoporosis? Well, the Mayo Clinic says that osteoporosis is the condition that makes your bones brittle and weak. So brittle that a fall can cause a fracture. Sometimes just bending over or a simple sneeze or a cough can cause a fracture. Osteoporosis fractures are most common in the wrist, the hip, and the spine. So let's jump into it. What is the #1 thing to avoid with osteoporosis? Basically, it's flexion of the spine. It's bending forward. When you bend forward, you're putting pressure on the front of the vertebra. And in that situation, that vertebra is demineralized. It has less bone density. So by bending forward, it's compressing those vertebrae. And again, I've already mentioned a sneeze or a cough is enough to cause the fracture. So the key is to avoid flexion. So if you have osteoporosis and you're doing a crunch, if you have osteoporosis and you're doing a roll up, if you're doing anything going into flexion, it is contraindicated. Let's think about that. How often in a day do you flex your spine forward? Bending over to get your purse, bending over to get your shoes, bending over to put your socks and shoes on. Those are the things that we want to learn to move in a different way to avoid that flexion. Now I'm going to show you the #1 bone building exercise called a wall slide. It'll keep your back supported and straight and won't allow you to go into flexion. All right, so now we're going to do a wall slide. And what you're going to do is you're going to go to the wall and you're going to take your feet and put them about 1 foot to 1.5 feet away from the wall as you lean back into the wall. Now what you're going to then do is you're going to lower down, bending your knees, sliding against the wall, and then you're going to push right back up. Now we're going to add some breath into this. We're going to inhale as we go down, exhale, back up. Inhale down, exhale, back up. And we're going to do 3 sets of 10 of these. And you can go down as low as you can get to, with about 90 degrees being the max, which is going to be about into here. But you don't have to start that low. You can go down midway and back and forth. And this is going to strengthen the bones of your hips, your spine, and your entire lower body. Now comment below and tell me how this video has helped you. Now the reality is that bone density changes will take some time to show up. So you're not going to do these exercises today or tomorrow and then all of a sudden have a change in your osteoporosis scores. But over time, with bone building exercises and avoiding the things that you shouldn't do, like flexion that we mentioned, we can make significant changes in osteoporosis. Be on the lookout for our next video on our osteoporosis series. Now I want you to go to Amazon and download my book, Retrain the Brain to Solve Back Pain. Yes, this book is catered to people with back pain, but this entire book is osteoporosis safe except for 2 exercises in the very last chapter. And what are those exercises going to be? Things that incorporate flexion of the spine. If you live in Austin, come check out our Pilates classes or our weight training options. We've been helping people with osteoporosis for 16 years here in Austin. Thanks for watching, and we'll see you on our next video real soon.